Hello and welcome to Point of View Podcasts, a series of conversations from Kaufman Hall and Associates about the challenges and opportunities now facing hospitals and health systems. Annual budgeting is an arduous process that often isn't flexible enough to include the strategic and operational changes that develop within a fiscal year. Healthcare organizations are looking for forecasting approaches that are more efficient and responsive in the rapidly developing healthcare environment. Debra Miller, a vice president in the software practice at Kaufman Hall, joins us to discuss rolling forecasting, an alternative to the annual budgeting process. Debbie, let's start off with a definition. What is rolling forecasting?
Rolling forecasting is a process of identifying what's the gap between your long-range financial plan, and which is what do you want to be when you grow up, if you will, for your organization, and how you're currently operating your organization. So it's identifying those changes today that need to be made to get us to that future state.
So what are the key differences between rolling forecasting and more conventional annual budgeting?
Rolling forecasting, the biggest difference is the level of detail. Annual budgeting would be a much more detailed analysis of everything down to minute levels of detail as to what's going on in the organization. However, rolling forecasting is intended to be the terminology that's usually used is nimble, quick, and efficient. It's a process of reviewing your operations on a quarterly basis. And so instead of doing budgeting 4 times a year, the trick there is to review what you're doing, get the feedback that you require, make the changes that you need, and move on to making those happen. It's also, like I said, the level of detail, doing things more at a more summary level, not at the organizational level, but more at a grouping of departments, really looking at how you operate as opposed to the individual cost center structure of an organization, which sometimes creates a siloing effect that also creates some barriers during an annual budget process. Rolling forecasting is more looking at the flow of patients and how we serve patients and how does that process work.
What are the major advantages to rolling forecasting?
Like I said earlier, the nimble, quick, efficient thing are terms that are not associated with annual budgeting processes in any way, shape, or form. And so rolling forecasting, again, is intended to be a review of our operations, but in a very short time frame, a very quick review of where are our trouble areas and identifying what we need to do to address those, as opposed to reviewing everything that's working fine, which we do during an annual budget process, but we still waste a lot of time reviewing those types of things. The other is it's more timely. Another large complaint about annual budgeting processes is, it's wrong before we even start the fiscal year. I can't tell you how many times I've heard that comment. And so reviewing things as changes occur in the organization is a key part of rolling forecasting and a huge advantage of that over an annual budget process.
Are there any drawbacks or times when annual forecasting would be more appropriate?
Again, the level of detail is probably, the one thing that helps with comfort level, and it's the way we've always done things in healthcare. And so that annual budget process, sometimes that would be one disadvantage of the rolling forecast process. But like I said, a lot of times we're reviewing the wrong things during the annual budget process. We're looking at the things that are working and still reviewing those, which is simply a waste of time.
Rolling forecasts use forecast groups. Can you explain what these are?
A good example of a forecast group would be surgical services. It includes the departments, or what's normally defined in a general ledger structure as the departments of surgery, recovery room, anesthesiology, perhaps other departments that provide that service. And so the rolling forecast would be developed at the surgical services group level, where the managers of those individual departments are working collaboratively to put together the forecast, as opposed to the manager of surgery, recovery room, and anesthesiology putting together their individual budgets. Again, that siloing effect. Rolling forecasting is again, a more collaborative effort, a group effort of talking about what are the challenges of each of those departments and how do we work together as a group to address those.
What are the key processes and changes that must be made at an organization to implement rolling forecasting?
The biggest challenge, I mean, there's a huge cultural component to rolling forecasting because of the impact on not having a budget or the implications of not having a budget. And so that's one of the biggest things that needs to be considered. You have to think about everything that requires budget versus actual reporting and think about how does that change if we don't have a budget. Or if that reporting is done on an annual basis, your rolling forecast could replace the annual budget, or your long-range plan could be your annual budget. So there are alternatives to replacing the budget process, but it's more on the month-to-month process where that's going to cause the biggest change. It's also going to, a huge part of rolling forecasting is the executive support of that process. If you don't believe that we can manage the organization using a rolling forecasting process, it's just a tool for your line managers to use, but it's not something to support the executive leadership team, then don't waste your time.
So how do you foster a cultural environment that would be receptive to rolling forecasting?
The ones where I've seen it most successful have been led by the CFO or the CEO. Traditionally, budget versus actual variance reporting is about setting targets and to some extent holding people back, whereas rolling forecasting is all about continuous improvement over my past performance. And so it's a very different way of thinking about things, and the executive leadership team needs to understand that. It also fits very nicely with what a lot of organizations are currently doing in terms of lean accounting or HOSHN or continuous improvement.
How does rolling forecasting serve as a tool for continuous monitoring?
Because it fosters this quarterly review process, the process of reviewing what's going on in the organization in a short time frame, but having that defined time, if you will, to do that review really helps with furthering the goals of the organization.
What kinds of organizations are using rolling forecasting?
We have clients who are small, single, 300 or 200 bed community hospitals, all the way up to large multi-hospital health systems that are using rolling forecasting. The ones that are most interested in it are those that are in acquisition mode in terms of physician groups, because acquiring a physician group, even if it's 5 physicians or 10 physicians, can very rapidly change the dynamics of an organization. And so if that wasn't anticipated as part of the annual budget process, you're kind of stuck with a budget that's out of date again. Whereas a rolling forecasting process, we've acquired this physician group, what are the implications of that? What changes do we need to make to operations or to our plan? And we move forward then with that adjusted plan. The feedback that I get from a lot of health systems who have physician acquisition, that's the biggest complaint about the annual budget process is, again, it's wrong next month because we just acquired 5 new physicians and they're changing the dynamics of the organization.
Are these organizations looking to rolling forecasting as a replacement for annual budgeting or more of an adjunct?
It really depends. In some instances, we've had clients who've been very successful in abandoning annual budgeting and moving forward with rolling forecasting. Others, it's taken a longer time frame because of the fact that their organization is very ingrained in a lot of detail. And so therefore, they need to kind of have that budget crutch as they hone their forecasting skills. That's the other thing that I'm seeing is that, forecasting isn't something that necessarily healthcare is real good at. And so helping the finance team be more comfortable with the forecasting process, because it's a different skill set than doing an annual budget, has always been a challenge. So what usually happens is if you think about your fiscal year, you just finished your annual budget, the best time to really start rolling forecasting is that in that first 6 months, so that you kind of have the crutch of the budget, if you will, to fall back on as you're honing your forecasting skills. Once you get to your second quarter review, then you can make the decision, are we comfortable enough with moving forward with rolling forecasting, or do we need to do another budget? And that's really where a lot of our clients are making that decision. So I'd say for those that have gone through the process, they at least have a budget for a year, if not 2 years, until they're comfortable enough to move forward with rolling forecasting.
How can organizations approach rolling forecasting?
Within the software tools that we have here at Kaufman Hall, we've created a process where we can use the same information that you've traditionally used for budget variance reporting, your general ledger actuals, and summarize that up to a quarterly basis and then into these forecast groups that I discussed earlier. There are also forecast account groups, which generally match up with your income statement categories, salaries, supplies, et cetera. There are exceptions that you can make to that because, again, when you're trying to do the forecast, you don't necessarily need to go to the same level of detail that you did when you did your annual budget. Once those are defined then and that data is summarized, we have a forecast workbook that is created that then the forecast director, the leader of that forecast group, would then work with their team to update as to what they expect over the next 12 quarters. So it's really a 36-month horizon, reviewing, using historical relationships, what's going to happen and what changes to those relationships do we need to reflect in that go-forward forecast. Once that process is completed or that data collection process is completed, then those results are posted to the database, and then through reporting and summarization, we can compare the results of the next 4 quarters against our annual plan or year-to-date actual plus the remaining quarters against our annual plan to see if that is going to close that gap that I talked about at the beginning, which is, again, the gap between where we want to be and how we're currently operating.
That was Debra Miller, a vice president in the software practice at Kaufman Hall. To hear more in our Point of View podcast series, go to kaufmanhall.com.